Action.
Good evening, everybody. We're here tonight to discuss maternal mortality with our African sisters. In Africa, mothers are dying at an alarming rate during childbirth or after childbirth. The main causes of this is lack of education, lack of healthcare access, and their low social status in their society. Now, we need to help these women by supporting the organizations that are helping to support their communities, such as Alafia, which is a women's health organization. There's UNICEF, and there's also the United Nations Population Fund, also known as UNPF. Now, as I noted earlier, education is one of the number one factors that is affecting these women, their lack of access to it. Now, if we can get them proper education, it would greatly decrease their rate, namely by providing them with access to pre- and postnatal care, which will increase their survival rate. Also, according to the United Nations Department of Public Information, our highest risk of maternal death tends to be with adolescent girls. In Africa, they tend to get married young and they start having children earlier. But if we gave them at least 6 years of education, it can greatly cut that down, and these women can then educate their own children, which will come into full circle because then they'll teach their children about prenatal care, postnatal care, which will increase the survival rate. Now, one education program that is helping is Alafia, as I mentioned earlier in the introduction. Now, you can go to their website, alafia.com, click on their shop link, click donate, and then there's a link that says maternal health. Simply click that, $25 can go a long way, or you can even purchase a $12 t-shirt. Now, besides lack of education, they also have a lack of healthcare access. Now, this is because there's not enough attendants that are skilled to assist these people. For example, there was one article called Africa Maternal Mortality, a Human Rights Catastrophe, and where Sonyana Maga told the United Nations Human Rights Council that out of the 500,000 deaths that occur annually across the world for mothers that are giving birth, 250,000, that's half of them, occur in Africa alone. And also, according to the authors of Disease and Mortality in Sub-Saharan Africa, these causes of death are from hemorrhage, which is bleeding out after they give birth, sepsis, which is the infection from not having enough clean materials or clean tools to use, as well as eclampsia. These are preventable deaths. If there was a skilled healthcare attendant there, these women could be alive. But only 50% of the births that occur in Africa include a healthcare attendant. Also, these attendants need to be trained properly. They need the midwifery skills, or at least transportation to get them to an emergency care facility if something is to go wrong during the birth. Now, UNICEF and UNPH are all working to help improve access to health care, but they have limited funds, and they cannot do this without our support. We need donations. Also, women need to improve their social status. Now, in Africa, the social norm is that women tend to be on the bottom rung. You know, in the family hierarchy, they tend to be at the bottom, and in society, period. So the World Health Organization recommends gender equality to help improve the maternal access to healthcare services to improve maternal death. So they need adequate care, but there's a correlation with poverty and with gender equality. The poorer you are, the less you tend to be treated equal. So you're not really getting any adequate health care, and you're also being hurt during violence and from your relationship, and you're not empowered. So there's a lot of disempowerment there. Also, pregnancy is considered a woman's concern. No, the men don't really take a part of it. So you're already poor, you don't have money, it is not anybody's concern but your own. You don't have money to go get help or transportation. That's why they need our support with funding. So once again, in order to decrease maternal death, we all must be aware of this issue, and we all must support these programs. Namely, the causes of death, lack of education, lack of healthcare access, and their low social status. Now, UNICEF, Alafia, and UNPF are just a few of the programs I found that are trying to help. All it takes is maybe a $50 donation. $50 can provide 10 women in Africa with antenatal health care. A $100 donation helps a rural clinic provide emergency care for pregnancy-related emergencies. All life is important, and just a simple donation can save lives. Thank you.